and this thing go dey the people body, they no go know. By the time they come dey show sign, they will come dey blame malaria and they blame typhoid. And then you talk about say the eyes fit come dey yellow. Okay, let's just talk about how people say they get them again, how it they spread. Then we'll come talk about the prevention. Wetin we fit do to make sure say we no carry hepatitis, because many of us they listen right now, you no even know whether it dey your body. So we'll just touch one or two stuff again, especially for the people wey just they come. Because if you just they come, we are talking about what? Hepatitis B. So I beg, no ask any question wey no dey related to the topic this night. Thank you. Dr. Israel, over to you.
Okay, now hepatitis B can be transmitted. Also, good for us to know say hepatitis B is a chronic disease. It's a chronic disease. As it be, as of now, we really never get a full cure for hepatitis B. Yes, with a fit manage, and there are some drugs you can take for a long time and go be like say don't go, you can stay. Or sometimes some people after they don't even take the drug, when they see test themselves, they feel notice say that they positive. That's why we say it's not really something where we say the cure, but with a fit manage and very, very well. So it's a chronic disease like hypertension, diabetes, HIV/AIDS, and all that. So we say it's also an infection disease that can be transmitted. So if you know any way where HIV fit be they fit transmit HIV. Now the same way hepatitis B, they can also hepatitis B can be transmitted as well. One of the way now through blood products. When person they transfuse blood when they not screen very well and the blood get hepatitis, so person can get hepatitis from that means. Another one are through knacking, unprotected knacking with someone when get hepatitis B. So not just knacking, because knacking not mean say because you knack you go no, but unprotected knacking with infected individual fit make you come down with the disease. Yeah, so that one has another way. Now another one transmission of mother to child. So the mama fit still transmit the disease give their pikin through maybe during delivering and all that. So because when their blood touch the pikin blood, there's everything there to say the pikin fit come down with hepatitis. So those when they use injection, when they use injections, injection drug users, people they will call them pigwees. There's people that people when they use injection, till they take drugs, drug when doctor not sometimes prescribe for them, add drug and all that. People when they use injection, all those people physically come down with hepatitis, because when one person use and get hepatitis, he pass on to the next person, and that one fit contact and through that means as well. Needle stick injury, you dey work, you not follow the normal universal precaution. Mostly for us when they work for hospital, you not follow the normal precaution, wearing your face, your glove and all that, washing your hand. If you prick yourself, you want go recap needle when you're not supposed recap. If you prick yourself and you go come down with and if the blood is infected with hepatitis B, you also fit get that infection. Now, this one thing when you need to know, hepatitis B virus is very, very. Most people think say HIV dangerous. I lie. Hepatitis B dangerous past HIV to some in one way. One of the way when hepatitis B is dangerous than HIV is that the hepatitis B virus, they stay longer outside the body than HIV virus. Now, HIV virus can stay within a minute, within a few minutes outside the host, outside the human body. It can stay very few minutes and it go die off. But hepatitis B can stay for hours, for a very long hours. And because of that, person the blood fit dey ground, and you go do something not knowing say hepatitis B dey that blood, you can't go use body carry am. Person fit
Mm.
even get fit dey infected through that means, because the virus dey stay longer alive even outside the human body, even outside the human body. So these are some of the ways when people fit take transmit, people fit take get the hepatitis B. Okay, so Dr. Fred, wetin be the other thing when you say we go talk
So we
after
talk
that?
about how we go take prevent them now.
Okay, how we go fit take prevent hepatitis B? Um, then we dey always dey talk the normal ABCD. When we say A, abstinent; B, be faithful. That's when we dey use when yes, that one as HIV, but you can also be you fit apply that one also for hepatitis B, because the way one person dey get hepatitis B na almost the way one person dey get HIV na almost the same way when they dey get hepatitis B. So the way you take prevent HIV, most method that you use to prevent HIV, you can also use it to prevent hepatitis B. And what is it? One, if you want knack, use protection. That one na one way when you go fit take prevent hepatitis B. If you must knack, use protection. Mostly when you don't know the status of the person, when you
Mm.
dey of your partner, use protection. Even when you know your part, and also if you do not get only one partner, e dey better make you dey use protection, so that make you not come from one person still give another person. So using
Mm.
of protection is one way to prevent hepatitis B. We don't talk abstinence, we don't talk be faithful. So be faithful to one partner and make sure that your partner is also being faithful to you. Another way to take protect yourself from hepatitis B is to test yourself. And you need to first of all do the test. Test yourself whether you get hepatitis B. So when you don't test yourself finish, the next thing wey go follow after you test yourself na the result. If you dey
Mm.
negative, vaccine dey. Dis one na im be the only difference between hepatitis B. One of the difference between hepatitis B and HIV. HIV for now e never still get vaccine, but hepatitis B get vaccine, and that's a breakthrough for medicine. And once you take the vaccine, you no go fit get hepatitis B again. Once you take the vaccine. So once you have test yourself and you come see say you dey negative, go take the vaccine. It is very, very important. It is very, very important. When you take the vaccine, you don't protect yourself from hepatitis B. It means say you no go fit get hepatitis B again. So in fact, that's the best way to prevent yourself from hepatitis B. And that's the best way to prevent yourself from hepatitis B. Now, we know say mother to child transmission dey, so it's also very good for us to prevent the child um coming down with hepatitis. From coming down with hepatitis. So every other measures when you fit prevent yourself from, when in terms of HIV, how you take give birth to the child, and you give there are some medication you give as prophylaxis, and sorry, I don't want, man, not gonna give you wrong information. No, sorry. I need to check that out. Dr. Fred, I need to check that out. I don't think there's any medication you give for hepatitis B. I don't I don't
For
think
who?
so.
For who? For who?
Hepatitis B for the baby.
Okay, for the baby. Most times now to prevent
Yeah.
them from the mother, make sure no fit transmit and give the pikin. And
Yes, the drug they
then
share
after she
medication there
give
when you
birth,
give the child.
they will come test the pikin.
Yes.
Not depending on the
Yeah.
finding, depend on the findings.
Okay. Okay.
Yeah.
Okay.
Thank
Yeah. I
yes.
really don't forget that aspect. But I know that there are some preventive measures that you do for your baby that will make your baby not to be negative, not to be positive. So if you are positive, e also dey better say even though you get belle, e no mean say you no fit born, or you go fit born. When you get belle, register your pregnancy on time, go to better hospital, preferably government hospital, so that they will give you the best management, and you'll be able to do the prevention for your baby very well. Okay, Dr. Fred, and over to you.
Yeah, thank you so much, Dr. Israel. If you just they come, you dey welcome. We dey talk about hepatitis B tonight. Now, the reason why we dey talk about hepatitis B na because so many people don't ask us questions about hepatitis B. So now make we talk about them. Any question where you get tonight, anything we know they clear for your eye concerning hepatitis B, ask us. Hopefully, by the grace of God, we go fit answer you. If you ask us any question, we know they related to hepatitis today, we no go take your questions, no vex. Huh? Today's topic is centered on hepatitis B. Now, before we continue, help us share this video so that more people go see them. Share the video, make more people know about hepatitis B. Now, after we don't talk about hepatitis B, somebody go dey listen to us, Dr. Israel. Mo will just hammer am before we start taking questions. This thing, this hepatitis B, e get cure, abi e no get cure? Because a lot of people go always dey disturb, say, I don't cure my own, oh, I don't cure my own, oh. So make we clear that part of this discussion right now. Over to you, Dr. Israel.
Okay. When I finish that one, we'll just only talk. We'll still talk a little about how the vaccine they go, how they take the vaccine. Okay. Now for this curing of hepatitis B, I think I made mention of it when they talk about small, that yeah, it is manageable. We can manage it very well. When we talk about cure, there are medication that you can take. Oh, but for some people, they really go. So most of the time, we know they really just want to say, you are cured for hepatitis B. No. So sometimes when we do the test and it's positive, there are still other tests when we go do. Oh, because not be even everybody that they just do, they even they start medication. Because you hear when I talk say some chronic state, we they call her where the sleeping dog lies. And so we say let the sleeping dog lie. If it is sleep, not disturb am, just leave am for there, make it dey sleep. So in some cases, this hepatitis B may not just be giving you problem. So you don't need to go and start looking for way to cause problem for yourself. So in terms of cure for hepatitis B, not really dey clear. Yeah, there are some studies that is still going on to get a good and a correct cure for hepatitis B. However, there are medications that you can take that will suppress the viral load to that extent that even when you test yourself, it can show negative. And it can even remain like that for a very, very long time. But there are some people, even when they take the medications for a long time, they still test themselves, it go still show, say that they positive. So that make
Mm.
you will not will just fully say this hepatitis B is 100% curable, because not be everybody they take that medication and they 100% cured. So that's just it. But studies are still going on to make sure that we have a better medication that will really be used, and everything will be fine. Yeah. Then another thing is, but the most important one is to just prevent them, because we say prevention is better, and it's also cheaper than cure. So why not prevent why not prevent it? So taking the vaccine is the best way, is the highest way of preventing hepatitis. In fact, every infection that vaccine, the best way of preventing them is taking vaccine. is taking vaccine. That's the best way of preventing them. And this vaccine is taken 3 times. 3 times. The first dose, the second dose, and the last dose. After the last dose, that's all you are protected for life. However, before now, there's some studies that said that after the last dose, you are protected for 10 years. But a new study came out to say that after the last dose, you're protected for life. Yeah, that you're protected for life. So the first dose is taken day zero. Then 4 weeks later, you take the second dose, and 6 months or so, you take the last dose. So after that, you are protected for life. So that's how to prevent hepatitis B. So it is better you prevent it than to dey think of, if I get am, I go treat am, I go take medication, and I will dey cured. Because that medication, you will take it for up to 6 months. Up to 6 months. And before we start knowing if there's anything. But before you even take those medication, we will need to do other investigation, try to check the viral load of the hepatitis, and to see, is this thing active or not, just like that, before we can actually say what and what we will do for you. Dr. Fred, over to you.
Yeah, thank you, Dr. Israel. Okay, now for anybody we get question concerning hepatitis for us, hepatitis B. If you get any question, hepatitis B, I beg, drop them in the comment section, and we go try to respond to you. If you just they come and you they try find out like wetin dey cause am, we don't talk about them in the beginning, so you came late. The program na 8 p.m. to 9 p.m. and we don't use about 30 minutes on the program. So if you just dey come, you come a little bit late, but we go try respond to you if you get any questions for us. Now we get one question here from Blessing. It says, Doctor, can I give a 4-year-old child the vaccine?
Okay. I don't want to mislead you. So what I will advise, I think when you get to the immunization center, when you get to the immunization center, they will be able to tell you if the 4 years old child can take it. But the answer is yes. The answer is yes. You can give the 4 years old child the vaccine. But now just that the dose might be different. So just get to the immunization center and find out.
Also, if now for Nigeria, you born the pikin, if you born the pikin for hospital, government hospital, even private, for a 4-year-old child, that pikin supposed to don't collect the vaccine because it dey for the normal
Yes.
vaccination plan for children, unless you no born the pikin for hospital and you no carry the pikin go for immunization. But if you carry the pikin go for immunization, every pikin wey dem born for our country, they don't give am the vaccine. But if you know say you dey a place where you know too dey sure like that, then go to your nearest primary healthcare center and discuss with them, and they will let you know. Okay, let's see. We have a question here. Queen, they ask question. It says, I beg, I keep hearing things online that I don't understand. Does hepatitis B have anything to do with fatty liver disease? Queen, now they ask this one.
Okay. Yeah. Hepatitis B can cause a lot of liver problem, and fatty liver disease can just be one of them. Fatty liver disease can just be one of them, including cancer of the liver and all that. So it's not like it's a wrong information. It's correct.
Also, if you get fatty liver disease fit also dey affect the liver, fit dey damage the liver. So fatty liver disease fit affect the liver, though e no go give you hepatitis B. Hepatitis B na strictly viral infection. Yeah. Okay, let's take another question here. Um, what Beatrice says, what is the cause of it?
Of what? Of
What is
hepatitis. Hepatitis
mm,
B is caused by the virus called hepatitis B virus. So there are different type of hepatitis.
mm,
We have hepatitis A, B, C, D, E. Now, the one we are talking about is hepatitis B, and is caused by a virus and is known as hepatitis B virus. So, how can you get it? May just be your next question. And then it can be transmitted through blood, eh? Through unprotected knacking. When you knack on someone when you don't know the status of the person, or when you get the hepatitis B and you will not protect yourself. Injection drug users can actually get it easily. So those are some means that it can be transmitted. Hmm?
yeah, thank you, Dr. Israel. Where can we get the vaccine?
If you go to our primary health centers, you are supposed to be able to get the vaccine there. And you are supposed to be able to get the vaccine there. In fact, every primary health center that is doing immunization, you can get hepatitis B vaccine in that place. So when you get there, just tell them that you want to take hepatitis B vaccine. The first thing they will tell you to do is to first of all go and check your hepatitis. To go and do the test. Because hepatitis B vaccine is not given to positive individual. It's only given to those that are hepatitis B negative. So if you are already a hepatitis B positive, you don't need the vaccine again. Because the vaccine is not a cure, it's not a drug for treatment. Now, what is the vaccine all about? The vaccine is just like introducing hepatitis B into your system so that your body will create. But the one that we introduce into your system is not enough to cause disease. So that the body will create soldiers that will respond to that which they've sent introduced into the body. And so when the body have created those soldiers, they keep guard so that when anything that look like hepatitis B enter, they will fight it off and kill them. So that's the way. That's what that vaccine does. So it's not like when the virus is already there, you now go and take the vaccine. No, it doesn't work. It doesn't work that way because the vaccine is safe. It's like the virus. It's like the virus. But the
Your
vaccine they introduce does not cause disease. It cannot cause disease.
your network be the break, but I hope we were able to hear you, Sha. Okay, we have another question here from Amadou Jallo. I was diagnosed of hepatitis and they prescribed tenofovir, and I've been taking it since a year ago now. My question is, will this tenofovir cure the hepatitis or it only neutralizes it?
Okay, as I earlier said, that's why I said there's no actual cure for hepatitis. Even, yeah, there are some studies going on for that. And I also mentioned that there are medication that I can give to you to suppress it or neutralize it as you've used the word, but suppress is the best. So that will help to suppress the viral load. You suppress it so to that extent that it is not doing anything, it's not causing any harm to you again. So that's the function of that medication that you are taking. And yeah, they actually prescribe the right medication for you.
Okay, let's take this. Some people say, but it's expensive. I just finished my third dose, and on every dose I took was 7,000 naira. Really? Where is that?
Okay, I really don't know the price for the medication. No, is it the vaccine you are talking about?
Yeah, vaccine, yes.
Yes, I think it's the vaccine. Oh, well, I don't know of that. I don't know anything about monetary. um, uh, um, implication when it comes to taking the vaccine. Most of the time, that's why we say Mona go primary health center. So when you go to a private place to take the vaccine, be rest assured that they will charge you.
Your network is
Eh?
breaking. I hope.
Can you hear me now? Can you hear me?
Yeah, it's better now.
Can you
It's
hear
better now.
me?
Yes, yes.
Okay. As I was saying, I said in terms of monetary involvement for the vaccine, I cannot say anything about that. But that one make us the tell Namona and go primary health center, government owned primary health centers. Even though those people will say may you pay money, you not go pay a lot of money. If you go
Mm.
even pay, it may not be more than 1,000 naira. However, if you go to private labs, private hospitals where these vaccines are also given, you rest assured that you will pay for it. Because it's a private investment, which they themselves also need money to run a lot of things and do a lot of many activities in the hospital, even to pay their workers. So they will always tell you to pay for it. But go to government establishment, primary health centers, or any centers that they do that they give immunization, even though it's teaching hospital that they give immunization, they will likely not charge you uh, for it, or even when they charge, it will not be as expensive as 7,000 naira. Thank you.
Okay. Let's see. This person is just coming. How many times can someone take the vaccine?
You can take the vaccine 3 times. Now, this is an advice. Most of the time, when you finish taking the vaccine, it's also very important, or it's very good sometimes, to try and do the viral load. Now, there's a way that the result comes out. And if you are fully vaccinated, even with the result, you will know. But if you are not fully vaccinated, with the result, you will also know. So that when you now notice that, I'm not fully vaccinated, you can actually go and take the vaccine again. It simply means that the dose that was given to you was not either, it was not correct, or maybe something, maybe the storage stuff for the vaccine was not optimal. So it is very good that it is important that you try to check your viral load, because sometimes when you check the viral load, it will show, this person has taken the vaccine. They will see it, that yes, this person has taken the vaccine, or this person have not taken the vaccine, or this person has the disease, or it is active, or the disease is there but it's just quiet, it's not doing anything, and it has been there for a very long time. So it is 3 times you take the vaccine: the first dose, second dose, and the last dose, before you can be fully covered from hepatitis B.
Mm. Yes, yes. So if you know, so you never take the vaccine, like we advise, first of all, get yourself tested. Huh? Okay. So if you have it already, will the vaccine still work?
The vaccine is only taken by negative individual. If you are positive, you don't need the vaccine anymore, because you are already positive. The vaccine is not to treat hepatitis B, it is to prevent hepatitis B. So it is given to hepatitis B negative individual. That is why before you even take the vaccine, you first of all do test. You first of all test yourself to be sure that yes, this person is negative for hepatitis B before the vaccine, before we can't give you the vaccine.
Okay. One more question. Can high enzymes come back to normal when taking medication? Hmm.
This is not related to our stuff or our talk. However, depend on the kind of enzymes you are talking about. So enzyme is not just one thing. There are some medication that can increase some enzymes in the body. When you stop those medication, the enzyme come back to normal. And there are some medication that does not have any effect on any enzymes. So it now depends on the kind of medication you are.
Okay, let's see. Michael is asking a question. Before we take Michael question, if you never share this video, share the live session. If you never share, click on the share button. Or everybody share. Michael say, can this vaccine be taken once? That is the 3 doses. You want to take the 3 doses together at once? Abba. Dr. Israel, I beg.
No, you cannot take it that way. That is why it is scheduled. And that's why it's scheduled. In fact, the funny thing is this: if you miss this schedule, you may restart the vaccine. Oh. Not may, you will, okay, you may restart the vaccine. The reason why I use may is because, when you've taken the first dose, take the second dose, maybe the third dose, you miss out with 2 days, they may not want to restart the vaccine, they may want to give you. But if you miss out with 1 month or thereabout, you go restart the vaccine from the beginning again, because it must be the 3 dose before you can say you are actually protected, and they must be taken as prescribed, not the way you want them.
Okay, Elijah is asking, share. Can we get the test done at healthcare center?
The answer is yes. You can get the test done at healthcare centers. And they have labs. So every healthcare center that have lab can actually do the test for you. However, if you go to the place in immunization center and they say they don't have lab to do it, they will write it for you to go and do. You go to a good lab, and not just any lab. You go to a good lab, you do it, and you take the result back to them. And then, in fact, sometimes they will even recommend the labs you will go. So you go to a good lab, do the test, and take the result to them. If they don't have a functioning lab, but they should.
Yeah, any lab around you should be able to do the test for you. It's not that expensive. Wherever you are, you can do. It's a very, very common test. For anybody that is just coming, um, you are welcome. We are talking about hepatitis B, and we don't go far. We don't talk many, many things about hepatitis B. How it is spread, within the cause and within be the symptom, how to prevent them, how did they take support people we get them. Yes. So if you, let's see. Everybody's asking, please, doctor, what are the negative effects of hepatitis B vaccine?
At least I think you should be looking at the positive effect of hepatitis B vaccine. One thing I've noticed about patients or about clients, most of the time they think about the good thing, now the bad thing they define. And I don't think we should always dwell in the negative aspect of any medication or any drug. Think about the positive aspect first. Because no medication when we go give you, or no injection we go give you, or no vaccine when we go give you, when no get side effect. Dr. Fred, are you with me?
Okay. If you are looking for a negative effect of the vaccine no get negative effect, na positive effect, and the positive effect na to protect you. For some people, maybe when after they take and they feel small pain for that area where they take the vaccine, after a while you go disappear. You understand? Basically, now the common thing where people they notice. For some people, they not go notice anything, but it's not as if it has any negative effects on your body.
Dr. Fred,
Yeah. Yes.
you can hear me?
Yes, I can hear you.
Okay. Yeah, that's
Okay.
it. and pain at the site of injection. That na one of the effects. And another one, sometimes some person can have weakness in that arm where they take the vaccine. Now there are some people that can be hypersensitive, that have hypersensitivity to medication or to some vaccine. So when they give you, you react anyhow to it. They will stop you. They will not give you the vaccine again because you they react to it. So because the vaccine and medication as well, and a drug, no drug will not get one or two side effects. But hepatitis B vaccine, the side effect is very mild. So the major side effect is just that pain.
Okay. Share this live. Everybody share. We want you to share so that more people go hear this information. Support us by sharing. Thank you very much. Thank you. Chinedu is asking us. He says, can it be transmitted to through kissing? Uh,
Well, I've not read any literature that gave any answer to that, but just I think you should play safe. That's all.
yeah. Same here. Okay. After taking the vaccine, Benedict is asking, after taking the vaccine for the 3 doses, you have completed the doses. Can the person now donate blood to another person?
Yes, you can donate blood because it's just a vaccine you took. Just like when you are a baby, you took vaccines now, and you took a lot of vaccine, immunization. All those immunization when they do, they are all vaccine. When you not think say immunization is different from vaccine, they are not different. It's the same thing. Immunization is vaccine. It's just to vaccinate somebody. So after you don't take the vaccine, you go still fit donate blood, and you go fit still donate the blood.
Hmm. Yeah, you go fit to donate blood. It doesn't stop you from donating, huh? Yes. Can a pregnant woman take the hepatitis vaccine? And will it not be harmful to the baby in the womb?
Okay. I don't think I'll be able to answer that. I'll go by, hopefully by the next life. I may have a good answer to that. I may have a good answer to that. But I don't think I've seen any case or read any case about pregnant women when take that vaccine get any problem with their pregnancy. However, if you are pregnant and you wish to take the vaccine, when you get to the healthcare center or wherever you want to take the vaccine, if they say no because you are pregnant, not take am yet, to that not be the people wey dey there, not be your fellow patient. If the doctor for there, or the person wey dey give the vaccine for there tell you say, for now that you are pregnant, wait until you born, eh you need to wait. Hope you
Yeah.
understand wetin I talk. Not be your fellow patient wey come take vaccine, or your fellow patient wey come for treatment because they say no, not take the vaccine as you get belle. No, let the doctor or the person in charge of that vaccine tell you, then you can now actually wait until when the right time for you to take the vaccine.
Okay. Thank you so much, Dr. Israel. We don't answer all the questions. So, we just do brief recap for the people we just they come. We just touch one or two important things about hepatitis B, and then we go round up.
Please, Dr. Fred, I think you should do the recap, please.
Oh yeah, now. Okay, so for those who just they come, we talk about hepatitis B. We talk say hepatitis now inflammation, little problem for the liver. Anyway, you hear hepatitis, and toxin are something that affect the liver, and hepatitis B in a virus. This virus it affects people well. You get other brothers and sisters, hepatitis A, hepatitis C, hepatitis D, hepatitis E. But today's discussion now majorly on hepatitis B. It affects people all over the world, and we talk say the way they spread, it is spread just like the way people say they get HIV. You understand that way? When you go and get unprotected intercourse, you meet somebody, we get una to go connect una self, you fit carry am, or sharp needle, people they give needle sharp sharp, you understand, or when woman get belle, she fit even transmit and give the pikin. And we also talk say hepatitis B, they enter people body fast pass even HIV, because the virus gets a lot of power, it can survive more outside. When we talk say the symptoms, most times you no go know say e dey your body. We dey call am asymptomatic. E go just dey like that. You no go know say this person get am o, e dey my body o. That is why we dey shout say abeg everybody wey dey lis ten to us o, first of all go test yourself to know whether e dey. And then later some people fit come notice say dem dey feel small cold, body pain, headache like that in the beginning, because hepatitis B, e get acute stage, e get chronic stage. Acute, e fit just come, you dey lucky, comot for the body. Chronic, e go dey inside the person body for long. When e don come dey enter chronic, e fit come dey affect the liver. Belle go dey pain the person belle fit swell up, the person fit get problem with the poo, the eye fit yellow, and many other things. And we'll talk about how to prevent am. First of all, if you wan prevent am, you first of all need to know whether e dey your body. If you no know say e dey your body, then there's a problem. Get yourself tested. If you no come get am for your body, collect vaccine. And na the vaccine we dey talk about, since the vaccine dey safe. 3 doses. I don collect my own. You collect the 3 doses, they are safe, they go give am to you. When you collect the vaccines complete, you are protected from the hepatitis. Do you understand? E don protect you. But no be say you go take the first one, you come forget, come travel, forget. No, you have to complete. Then, if you can't get am for body, you go need to do wetin? Practice safe knacking. If you wan meet your partner, if you wan knack, you go need to do wetin? Protect yourself. Not dey jump. You get plenty people, you understand? First of all, go talk say make you abstain, make you get only one partner wey you dey meet. If you wan dey meet people up and down like that, you use protection, you understand? And then for those wey get am for their body, no be death sen ten ce. When you follow the advice wey your doctor give you, they go give you some medication to support you to bring down the viral load. As long as the viral load dey down, you are fine. Say whether permanent cure dey, for now, no permanent cure. But I know some people go tell you say I can cure. No be say dem cure am o. Just that for an extent, the viral load go go down. After again, if e multiply inside the body, come out show. So these are the basic things you need to know about hepatitis B. And wherever you find yourself, try look for a near healthcare center, because their own go cheap. If you go private can be expensive because they go tell you make you pay. But if you go government center, they will give you the vaccine, and the vaccine go dey cheap for you. These are just the little things we need to know. Anything again to add, Dr. Israel?
Not really, not really.
Okay,
Just
now.
as you said, say you don't take the vaccine. Me myself, I don't take the vaccine.
Hmm. Yeah. Okay. Let's answer this last question and then we go. This last one. Can infected can infected people get married and have a child, and the child will not contact it? Abeg, answer then you
Ye-
round up.
Yes, infected people can get married and have a child, and the child will actually not contact it if you follow the precaution when your doctor tell you, and everything when you need to do to protect yourself and also the baby no go get am. So if na one partner dey infected, the other partner need to go to check himself. If he is negative, take the vaccine and you are safe. You are safe with your partner that is infected with the virus. And if na the female na dey negative, that's 100%. It's even very fine, because you are negative. Even though when you born, your pikin will always be negative, because you wey
Mm,
carry am for belle
mm,
negative. Now, not be because we say yes, when you knack, you can transmit the virus, does not mean say when the sperm and the egg don't jam together that they form, because we say the sperm, yes, may contain, the sperm contains the virus. You come and say that because that sperm now mix with the egg, the pikin already gets the no, no, that's not how it's transmitted. It's because of um the mixture of blood between the mother and the child that can actually be the risk where the pikin fit get am. So not be the formation of the pregnancy go make the pikin get am. Because I don't see question when somebody come meet me say, my husband na positive, me I'm negative, and I wan get belle. Hope if I get belle, my pikin no go get am. And I was like, why will your baby have it? You are negative now. So we are not really worried as far as you are negative. He say, not be my husband will be positive, wan sleep with me. That was when I knew that he's thinking that because of the sperm fit just make am dey, if e just mix with the egg, the pikin go just turn positive. No, it's not like that. It's just a mixture between the blood of the mother and the child. So if the mother is positive, and there's a tendency can transmit it to the child, but she may not transmit it to the child as well. Thank you all for today and for joining us today. Today I'm a little bit stressed. I had a lot of assignment this period. In fact, that's one of the reasons why I even joined late, because I just the enter as now I just log in so that I
Mm.
will always be with you um, every Sunday, as we don't promise ourselves, and we don't promise you say we go always do with you every Sunday. So thank you so much for coming out. And Dr. Fred, thank you.
Thank you so much, Dr. Israel. Thank you so much. Easy. I want to thank you for always coming here with this program now every Sunday by 8 p.m. Nigerian time. So we go beg you, try not to come late and make you join us on time so that we know we extend beyond 9. We are very careful with our time and your time. So we want to say thank you. Help us share this video, make more people come learn. We are using Pidgin English so that everybody can understand. That is why we're using Pidgin English. So you understand, eh? And thank you very much. We will see you again next week Sunday. For anybody who want to join my private Telegram, you can subscribe. Look for the link, subscribe and join. I always tell you, good life now waiting. Good life. Everybody, good life. Now sense. Take care and have a wonderful week ahead. Bye bye.
See ya.